Please join me in welcoming to the Distinctive Voices podium, Dr. Linda Harris.
Well, thank you so much for that kind introduction and interesting tidbits that you chose from my resume. It's really an honor to be here tonight to give this presentation, and what I'm hoping to do is to give a broad overview of some of the current issues, the current knowledge, the current thinking in the area of food safety. So I wanted to start my slide with something positive, because often I get challenged, I get so into what I'm talking about that at the end people wonder if I ever eat at all. And and just coming from the holidays, food and beverage is something that we do with friends. It's a way we celebrate. It's a very important part of our everyday life and an important part of what we do. And so I bring that up because I enjoy food very much. I also challenge you the next time you're in a grocery store to not be in such a rush, to perhaps stand in the produce section and look around at the over 350 products that are there, and then maybe stand in the cereal aisle and look at the hundreds and hundreds of cereal choices we have, and wonder where all of those ingredients came from, and how many hands were involved in growing those crops, in inventing or developing the different food products, and then to getting them through the distribution shelf and into the grocery store. I think it's a tremendous choice that we have, particularly in California, where we're blessed with being in a major agricultural state, and I think too often we take a lot of that to advantage or forget how much goes into what we see. So I wanted to say that because tonight really what I'm going to be focusing on is foodborne illness. We're talking about diarrhea and vomiting, and with some enthusiasm, as I mentioned, and food microbiologists are one of those types of people that were very comfortable sitting down at turkey dinner and actually having a discussion about diarrhea and vomiting. And most of the time when I do, it's because somebody who's not a food microbiologist has asked me a question, because everybody has a question about food and food safety. I'm going to start, again, backing up a little bit to talk more generally about food in the news in 2011, because when I started to put this presentation together, what I decided to do is just to look back at 2011 and to focus my entire talk on 1 year, what happened in food safety in the past year. And I knew it was a big year because I was pretty busy last year, but as I went back and looked at everything, it was a bigger year than I had even imagined. And not dealing with microorganisms on a direct thing. I remember when the tsunami hit last year, watching the devastation, the human devastation, but also I remember particularly one video in which thousands of acres of agricultural land were flooded in a couple of instances. And of course, the Fukushima nuclear disaster led us to question whether that would influence crops that were imported into the country, and that led to some import actions. It also led to a fair amount of testing of food and water in California and across the country to determine whether there was any fallout from Japan. Also last year, there was a lot of discussion about how close we are to hitting 7 billion people worldwide, and how we're going to feed those people. And I pulled this figure from the U.S. World Census clock, which is ongoing. You can actually sit there and watch the numbers change on your computer. It was also, as I mentioned, a year where we talked about how we're going to feed these people, and clearly almost 1 in 7 people are in poverty or hungry. And also in East Africa, it was a year of catastrophic famine as described by USAID. Closer to home, it was also a year that we continue to be concerned about obesity and the trends for increasing rates of obesity across the country. And as part of dealing with that food safety issue or that health issue, in June of this year, we changed from having a pyramid guidance for consumption for healthy eating to a choose my plate. So this is a different way of trying to get people to eat appropriately, to try and avoid the problems that we have with obesity and the resulting health issues associated with that. So that's my acknowledgement that there's a whole host of issues out there that are related to food and to safety and to health. And I'm not going to be talking about any of them other than what I've just said. The rest of my talk is going to be focused on bacteria and viruses, parasites that can get into food under different circumstances and after consumption can make you ill. And I'm going to start with some of the news that was international. And for me, this was the biggest, perhaps, news outbreak that we've seen in a very long time. It created headlines around the world for several months. And this was an outbreak that was associated with consumption of eventually fenugreek sprouts. Now, I know alfalfa sprouts and I know clover sprouts. I'm not so familiar with fenugreek sprouts, but apparently these were the type of sprouts that ultimately were associated with its illness. In November, there were a couple of publications that came out related to this particular outbreak. On the bottom is what we call an epidemiology curve, and I'll be showing several of those this evening, looking at different outbreaks. There's several striking things about this particular epi-curve, and that is the very long time frame for this outbreak. It spanned from early May to mid-July. It spanned that long because it took that long to figure out what had happened. If you remember, for the first food item that was implicated in this particular outbreak were Spanish cucumbers, and that led to hundreds of pounds, thousands of pounds of Spanish cucumbers being dumped. And later it was discovered that it was the sprouts. Sprouts are very difficult to identify in outbreaks because they're kind of an afterthought. They're a topping, they're something at the side, and so when you're asking people to recall what they ate, sprouts are not often what they recall. The other thing that was striking about this particular outbreak was the organism that caused the outbreak, which was an E. coli 0104, but it was an organism that was a blend of 2 different types of pathogenic E. coli and not something that had been seen before. So some of the highlights, if you will, of that particular outbreak were that there were imported seeds from Egypt. And one of the things that happens when you take a seed and you make a sprout is that you water it and you grow it under warm, moist conditions, which we know are absolutely ideal for all of these organisms that cause foodborne disease to multiply. In the U.S., we've had numerous outbreaks of foodborne illness over the last 10 years. all related to consumption of sprouts. And in fact, in 2011, there were 2 separate outbreaks associated with consumption of sprouts here in the U.S., and I'll mention that in a couple of minutes. The focus of this outbreak was Germany and a region of Germany, but there were 15 other countries involved. France actually had an outbreak where there was a cluster of individuals who had the seed purchased from the United Kingdom, and a separate outbreak happened in France. But all of the other countries that were involved were actually people who had traveled to Germany, who had the sprouts in Germany and then eventually made it home, and were either counted as ill in Germany or ill back home. So as I mentioned, this was a E. coli that was unusual. We often talk about E. coli 0157H7, and I'll be talking about that a lot more. That is a Shiga toxin producing organism, and this particular E. coli was one that is referred to as enteroaggregative E. coli, but it had picked up one of the genes from the Shiga toxin organism. So this was 3,816 cases, which is a very, very large food-borne outbreak. 54 people died, again, very tragic. And what was also striking about this is that in many cases of E. coli illness, about 6% of people will develop hemolytic uremic syndrome, which is a shutdown of the kidneys, and it can develop into very serious illness. In this particular outbreak, 22% of the cases developed hemolytic uremic syndrome. So a much more virulent type of organism. I selected this one figure from the 2 papers that I mentioned because for me it actually is not that dissimilar from many of the outbreak investigations that go on. What this shows is the point source, the company that had the seed that were sold. So, and then all of these nodes were different sprouters, and each of these red squares were separate outbreaks that occurred in Germany. And so the point is that you have these seeds that are imported and then sold to many, many different places. And in fact, those seeds were sold to the UK, and the seeds were then sold from the UK. They were purchased from people in France. And so you have one contaminated batch or from one location, and it's spread over many, many places. And you can see just by looking at this that would have been a very complex outbreak to investigate when you have all of these different clusters of individuals and trying to pinpoint what caused the disease. Switching then to microbial food safety in the domestic scene, we had a lot to talk about here, and there were a number of really key papers and publications that came out in a number of outbreaks. In January of last year, there were 2 publications that came out, and for those of you who aren't into food microbiology, maybe they weren't ones that you read already, so I'm going to tell you a little bit about them. But every 10 years or so, the Centers for Disease Control does a publication, presents a publication where they estimate food-borne illnesses in the United States. And the last publication came out in 1999. So we were well overdue for this publication, and I, as well as others in my area, were anxiously waiting for these publications to come out. There were 2 of them this time. Previously, there was only a single publication. And the 2 publications focused on unspecified agents, which I'll talk about in a second, and then major pathogens. So what is an unspecified agent? This is defined as is an organism that's known to cause illness in food, but we just have almost no data about it. We know that that association happens, but we don't systematically record those illnesses. So there's very little information for us to get numbers when we're trying to estimate burden of disease. There are other organisms that are known to cause human illness, but we don't know if that human illness comes from food. So the link between illness and food is unproven, but suspected. And then there's a known food source, but an unrecognized cause of illness, so that you know that a particular food is making people sick, but you don't know why. And then we're always discovering new organisms that we weren't aware of that existed or weren't aware were capable of causing foodborne illness. So with that as a pretty daunting task, the authors took it upon themselves to try and estimate how much all of the unknown is causing. And what they did was that they defined foodborne illness as episodes of diarrhea, so 3 or more loose stools in 24 hours, or vomiting, each of which lasts greater than a day, or is so severe that it restricts your activity. So you could have diarrhea so severe that you could go to work, but it only lasted a day. It still would be included in this. I need you to remember this because I'm going to give you a quiz in a couple of minutes. Okay, so what did they estimate from the unspecified agents? They estimated that there were 38 million illnesses a year in the U.S., 72,000 hospitalizations, and approximately 1,700 deaths each year. If we move to the major foodborne pathogens, there are actually 31 major foodborne pathogens that we consider when we look at foodborne illness. And of those 31 major pathogens, 9.4 million episodes of foodborne illness a year. You can see here the other, so there's a whole group that are 11%, and the rest is all caused by just a small number of organisms. Most foodborne illnesses caused by known major pathogens are norovirus. We don't do a very good job of documenting cases of norovirus. Most of the time, it's self-limiting, it's mild. Most of us would consider it the 24-hour flu. So even though there's a lot of us being succumb to norovirus every year, it doesn't lead to being counted in other ways as in outbreaks. Number 2 is salmonella, which will come up over and over and over again in the rest of my presentation. Number 3 is Clostridium perfringens, and number 4 is Campylobacter. And I can talk about the distinct characteristics of each of these organisms later on, but I just wanted to, for now, give some overview and some highlights. So hospitalizations, now that switches. So salmonella becomes number 1, norovirus, 26% of the 56,000 hospitalizations per year, Campylobacter, and Toxoplasma gondii. And Toxoplasma did not show up as a major cause of illness, but it is a major cause of hospitalization. And for the major pathogens, then, an estimated number of deaths of 1,400 a year. Again, Salmonella, Toxoplasma, Listeria monocytogenes, and norovirus. Now, I'm sure some of you haven't heard of some of these organisms, and I'm sure if I showed you the entire 31, they're not things that show up in the news every day. As a result of this publication and of other things that happened last year, the CDC published, they have a periodical called Vital Signs, and their June issue was making food safer to eat. If you combine those two reports together, and this is the number that you'll see in the newspapers all the time, they love to use these numbers, that there are 48 million illnesses per year, 128,000 hospitalizations, and 3,000 deaths. And that translates in 1 in 6 individuals in the U.S. ill at some level from foodborne illness every year. Or if you, it doesn't really translate to very well to an individual risk, but you know, once every 6 years, maybe you might have a bout of foodborne illness. A little less if you practice safe practices, a little more if you're on the risky side of eating behaviors. So if you look at documenting foodborne illness, what I've just shown you are the estimates by the CDC. That's that whole population exposure. Most of those cases are pretty mild. And we don't count them under normal circumstances. So now here's the quiz. If you remember the definition of acute gastroenteritis was 3 or more stools in a 24-hour period, or vomiting, and both of those things, either or, for over a day. How many of you will admit to experiencing foodborne illness sometime in your life? All right. Okay. So you are in this exposure and you are admitting to displaying symptoms. How many of you, if you think back to whatever you were thinking of, and probably you were remembering it with some vivid memory, how many of you actually went to seek medical advice? Okay, so we went from almost everybody in the room to maybe 10 people. How many of you, okay, I know it's getting really personal, but how many of you did the doctor ask for a stool sample? A couple, maybe one. And if that stool sample was taken, maybe or maybe not, an organism was identified. And if it was a reportable illness, then it would have, some paperwork would have been done, and it would have, that information would have been transmitted to the CDC. So there's 2 ways of counting these people. And one of them is to use something we call the FSNet sites, and we call this active surveillance. But even for the active surveillance, all of these things have to happen. You have to have people who are sick, who go to a doctor, who give a stool sample, who have an organism identified, and then that organism is counted. Under diagnosis really is organism dependent, and of course the more severe the illness, the more likely you are to go for assistance with or medical advice. These numbers are the numbers that they use to estimate foodborne illness. So if you have an outbreak of foodborne illness, and it is a salmonella outbreak, for every case that gets counted, you multiply it by 29. So in that outbreak in Europe, where we had almost 4,000 cases, the multiplying factor for E. coli is about 26. Now maybe that outbreak was a little bit more severe, so maybe the multiplier wasn't as great in that outbreak. But the point is, I think we showed here in this audience that it takes a lot, even when you do have foodborne illness, to get anywhere near to being counted. And that's why the numbers that we see when people are actually counting real cases that have actually identified the organism in their stool sample, why there's a huge disconnect between that and the numbers that are estimated. So FoodNet was established about 15 years ago, and they publish an annual update. The update was published for 2010 in November. And so it's called the Foodborne Disease Active Surveillance Network. They have 10 sites, one of which is in California, and it's located in San Francisco, but it's Alameda County, Contra Costa County, San Francisco, and the city of Berkeley. And then you can see there are other sites spread across the country. Within those sites are about 46 million people, which is about 15% of the population. They have a list of 10 foodborne pathogens, and they work with the medical labs in each of those areas, and they get all of their reports for all of those 10 pathogens, regardless of whether they're in an outbreak or not. They count everything. They count it whether it's foodborne, whether they know it's just a stool sample and an isolate for one of these 10 organisms, and it gets counted. And then this is used to also give some sort of information on kind of the health of the country as far as foodborne illness goes, how well we're doing, and where we can go from here. And so one of the things they do is, since they've been doing this since 1996, they now have enough data that they can actually compare from year to year. This was one way of evaluating it this year. They looked at both increases and decreases, the percent. So they took the numbers that came in from 2010 and then compared it to the average from 96 to 98. And in all but 2 cases, we saw a decrease. And in 2 of those cases where I've marked with a red star, there was actually a significant decrease in overall incidence of these laboratory-confirmed infections. And that was with E. coli, O157H7, and actually the broader group of E. coli that STEX, they call them, Shiga-toxin, E. coli, because they produce a similar disease. Vibrio has gone up. This is Vibrio vulnificus. It is associated with, it's a subpopulation who are susceptible, usually very immune compromised, liver disease, and it's associated with eating raw oysters. And so the comment they made is our intervention strategies aren't working so well for Vibrio vulnificus. Salmonella is the other one where we simply haven't seen any budging of the numbers of Salmonella, and you'll see that Salmonella comes up over and over again. It was the number 1 in the estimated foodborne illnesses. It comes at number 1, a leader in any way you kind of measure this organism, and it's one of the major organisms that I work on in my laboratory. Another huge publication that came out this year came out of the University of Florida. And one of the things that's really difficult is if you look at all these numbers, 48 million cases of foodborne illness a year, somebody should be doing something about it. But what do you do? How do you strategize for doing the things that are going to make the biggest difference into reducing the numbers of foodborne illnesses? And one of the things that people have been moving towards is attribution, looking at food and pathogen combinations, looking at some way of measuring in a rational way one organism to another when each causes very different diseases, affects different parts of the population, is associated with different kinds of foods. So this is the premise behind this particular publication, ranking the risks. And really, in order to do this, they took those estimated numbers of illnesses. They worked on 10 different pathogens. And then they knew from the literature how much was mild from that particular organism, how much might have been moderate, how much was severe, the severe cases, how many ultimately fully recovered, how many died. That's not such a recovery. And they try to include chronic illnesses and long-term sequelae. And many different foodborne illnesses are the diarrhea and vomiting that we talk about, the acute stage of the foodborne illness, but many of them have very long-lasting debilitating sequelae. Guillain-Barré syndrome it causes paralysis, and it can take a very long time to regain use of your limbs. Listeria monocytogenes can cause miscarriages, stillbirths, and can cause lifetime mental disability. And those are just two examples of things that can be severe. So what they did then was then to try to put numbers to those things in each of those boxes. And of course, that's a very, very challenging thing to do, but that's basically where we are in starting this conversation of how do you rationally put your dollars into trying and solving this problem. So they did 14 pathogens and 60 pathogen food pairs. They used something called quality-adjusted life years, and that's a measure of health-related quality of life. I can't say I understand completely how you come up with those numbers, but what it gives you are years, population years of loss. And you can see in this, they came up with a burden, a disease burden of $14 billion in 2009 dollars. 61,000 quality of life years lost every year. And so that was the estimated burden. The combined rank, greater than 90% of that burden was caused by 5 of the pathogens: Salmonella, Toxoplasma, Campylobacter, Listeria, and norovirus. And you can see how the difference between the cost of the illness and the quality of life years. Those are kind of shocking numbers, and I guess in part they're meant to shock. When you look at the combined pairs, the ranks from 1 to 10, I did not rank them in order. I grouped them by pathogen. And so again, even though Salmonella was 4, 6, 8, and 10 on the ranking, overall, it was number 1. Poultry came up twice as a pair. Campylobacter poultry was number 1, and Salmonella poultry was number 2. And complex foods came up a couple of times, one with Salmonella and one with norovirus. Complex foods are, as described by the authors, in many of the cases where they were investigating these particular outbreaks that they used for their database, these are foods that are prepared out of the home. Further down the food chain, they tend to be, say, in restaurants or in food service establishments. So these are foods that the errors that are having, or the contribution, is human error, and a totally different approach to solving that problem than perhaps for some of the other pairs. Along the same line, this publication came out just this past week, Economic Burden from Health Losses Due to Foodborne Illness in the U.S. And he's taken a slightly different approach. He put a dollar value on quality of life year estimates, and so he came up with a little bit larger estimate, $77 billion a year. He used 2 different models. One was $55 billion a year. Again, large numbers, something that by all measure we should pay attention to try and decrease those numbers. I wanted to point out that these costs don't include the long-term sequelae. They don't include the cost to industry for recalls, destroyed product, loss of production, and brand value. And they don't include costs to public health. Outbreak investigations are time and labor intensive and cost hundreds of thousands of dollars on a major outbreak investigation. And so all of these are costs to society that we haven't really even begun to measure. This particular author also ranked pathogens, and he came up with pretty much the same top 5 in a slightly different order, but Salmonella was right there at the top. The outbreaks of foodborne illness, they end up in the news, but most of these numbers are sporadic. The ones that never go to seek medical help, the ones that never have a stool sample taken, those are sporadic infections. That means one person here and one person there. And so one of the papers that was published this past year, just in December, was a systematic review of sporadic infections. And I thought I would, to summarize, anytime there's an odds ratio above 1, and where the confidence intervals are all above 1, that's a significant risk. And this particular study is a meta-analysis, so he took 71 different publications that had all tried to answer this question, and he combined all of the data from all of these publications. Animal contact is a contributing factor. Environmental water. Travel, particularly if you're in a Scandinavian country where they have very low domestic salmonella incidence. Traveling outside of Scandinavia is a risk factor for salmonellosis. For foods, it's eating in a restaurant, period. Eating chicken in a restaurant, and undercooked eggs. And then, interestingly enough, predisposing factors. If you're taking proton inhibitors for acid in your stomach, chronic diseases, and if you're on antimicrobials, all of those make you more susceptible to sporadic cases of foodborne illness. Okay, so we've talked about the FSNet, the active surveillance. There are reportable diseases. Many states are very good about reporting diseases, and those go to the CDC. We call this passive surveillance as opposed to the active surveillance system. And if 2 or more people are ill with the same organism in the same time frame, it's considered an outbreak. The timeline it takes to go from one to the other. For Salmonella, it's 1 to 3 days for you to get ill. If you look at these other organisms, and in particular Listeria monocytogenes, it takes anywhere from 10 to 40 days to show symptoms. So I'm going to show you the time frame for Salmonella, but for other organisms, it's much, much longer. It takes 1 to 5 days to get a stool sample collected, another 1 to 3 days to identify Salmonella, a few more days to go to a public health lab for that isolate, and then they fingerprint or do something called pulse field gel electrophoresis, digitize the fingerprint, upload it to PulseNet, where it is scanned on a daily basis. So these are fingerprints of bacteria that have been isolated, and there are labs both in the United States and around the world that collaborate on investigating outbreak investigations. This has greatly improved our ability to detect outbreaks that are complex and that are multi-state in nature. And so I'm just going to briefly go over a couple of things that happened in this past year. I've said Salmonella several times. Salmonellosis was a major, Salmonella causing salmonellosis was a major player in 2011. We had outbreaks with ground beef. kosher broiled chicken livers, ground turkey, and turkey burgers. And all of those are kind of the traditional thinking of salmonella. We saw an outbreak with imported whole papayas, with imported whole cantaloupe, with imported pine nuts, alfalfa, and spicy sprouts. I said that we had our own sprout outbreak. And interestingly enough, we had some pretty major outbreaks associated with African dwarf frogs and chicks and ducklings. And the chicks and ducklings were a mail order chicks and ducklings, backyard, hens are increasing in popularity. There was a place in Ohio that was distributing them, and they had these very rare salmonella that popped up all over the place. We also had a couple of multi-state outbreaks with E. coli. Lebanon bologna is like a salami type of product, romaine lettuce, and hazelnuts. And then also listed as a multi-state outbreak was this E. coli 0104 outbreak that occurred in Germany, with travel to Germany as listed as the cause. I'm just going to spend a couple of minutes talking about our domestic large scale outbreak that we had this year, and it was associated with listeriosis. This was an outbreak that was unusual. Cantaloupe, whole cantaloupe. It was the first outbreak with this vehicle. And I failed to mention on my earlier slides the hazelnuts was the first outbreak associated with E. coli. Papayas were the first time that they had been associated with salmonella. The official report was filed in December, but the outbreak it went on from May until July. 146 people, 99% of them were hospitalized. The ages from less than 1 to 96 years. Most were over 60. The median age, 77. 31 deaths. Listeriosis is a very severe illness. It affects only a subpopulation, mostly immune compromised, but it can also impact pregnant women, not so much from the health of the woman, but it can lead to stillbirth or miscarriage. And so there was 31 deaths. 30 were listed in the report, but an additional death occurred on December 18th, so it wasn't counted in that report. It was spread across the country with the greatest concentration in Colorado. That is because that's where the cantaloupe originated. You can see that the span goes from early August to November. That's the date of clinical specimen collection, but the outbreak actually started in July to October. So this is the number of ill persons by date of illness onset. This is the date of clinical specimen collection. Remember, I said that there's a delay, and if you remember, you have a delay of up to a month from the initial consumption. It took until September 9th to understand that there was an outbreak and to understand what that outbreak was about. Colorado warned consumers on September 9th to avoid consuming cantaloupe, but they didn't know what kind of cantaloupe. On September 10th, the farm that was suspected stopped production, and on the 14th, a recall was announced. I put this up because I spend a lot of time talking about numbers, and it's really easy to forget when you're talking about 48 million people that when you're talking about an outbreak of this magnitude, you're talking about a lot of individuals and a lot of families impacted by this type of tragedy. As I mentioned, the whole cantaloupe was to blame. There was some cut cantaloupe recalled. but mostly it was whole intact. It came from this one growing region in Colorado, very popular cantaloupe growing region, the Rocky Ford area. And the investigation revealed in this particular case that there was probably spread of contamination in the packing house from poor design, with possibly substantial subsequent growth of the organism during cooling after washing. So what do we do? What do we do about this problem of foodborne illness? Well, there's a bunch of things that are going on all the time, including regulatory approaches and a whole lot of non-regulatory approaches that involve not only government but industry and academics, and certainly I'm involved in the education and research area. Exactly a year ago today, the Food Safety Modernization Act was signed into law. The last time that a major change had been made was in 1938. The focus on this act is science and risk-based, and that is why a lot of these publications have come out in the last year. Several new regulations will be released in 2012, and that will create a tremendous amount of activity within the food industry. They've been gearing up for the last couple of years in anticipation of these new regulations. And so a lot of change is anticipated in this next year. Food systems are complex, but the Food Safety Modernization Act will focus on pre-harvest food safety with the produce safety rule, preventative controls and processing, and recognizing the importance of about 15% of our food is currently imported, and that's increasing every year. But there's a lot beyond that as we move down the chain that still plays a role in the number of illnesses. And there are parts of all of it that people are attacking one at a time. Just a couple of days ago, the combined agencies, USDA, FDA, and CDC, announced that on the 31st of this month, they are going to have a public meeting to discuss their own data on attribution estimates, and a work group and draft strategic plan will be unveiled as part of dealing with foodborne illness in the United States. So I'm just going to finish with saying this talk has been a lot about microorganisms and diarrhea and vomiting, but I still fundamentally enjoy food and beverage, and I do not spend my life worrying about what I eat, or at least when I'm not at work. So I'd be pleased to answer any questions if you have them.